Hi, everyone. Welcome back to another session of Diabetes Boot Camp. I hope you are doing well. Today's session, we're going to talk about a topic that essentially connects the three previous lessons together to assess how things are going overall. And that's, of course, has to do with monitoring. What do we know about blood glucose monitoring? What about some of the different lab values that are also used to assess diabetes product, but also take a look and see how it can be balanced through the rest of your diabetes routine. So again, thank you for tuning in. I wanted to do a quick follow up over our last class that we all had together. I know last week Rachel did a very good job at kind of reviewing some of the particulars with regards to medication, but I haven't talked to you since we had our last homework assignment, and that was completing our activity tracker. So I have collected quite a few through the email. So thank you for those of you that turned that in. And really, what we wanted to try to do with that activity tracker is to help you learn a little bit more about yourself. Sometimes when we write things down and we have it right in front of us in two dimensions there, it kind of shines a light on where there might be some opportunities for change. So, throwing a question out there to you, did you learn anything from your activity tracker? Did you try any new activities? And any activities that you tried, did you notice any impact on your blood sugar? So remember, we talked about physical activity is somewhat of a Mother Nature's form of metformin. Metformin is a very popular first line therapy medication, and physical activity works very much in the same way at helping shuttling glucose into our cells to be used for energy. So just wanted to see if anyone learned anything new about themselves from that activity tracker, and if something like that actually help you be more active. So you can drop those comments in the chat and we can hit those as they come up. But again, just wanted to touch base with you. And if you did not receive the activity tracker, you can go back to your previous emails. You'll see copies of it, and it's not too late to turn it in. Again, just a way to help chronicle progress with physical activity. However, today we're going to talk all about monitoring. So what I want you to do is visualize you're in the driver's seat of your car and you look on the gauges of what's going on in your vehicle, how fast you're going, how much gas you might have, what the oil pressure is looking like, what is your odometer reading, what does your battery life look like. All this is very helpful information, but probably the most helpful piece of information when we're looking at our dashboard is what? What do you think? What is the most important piece? The answer is not on the screen right now, but if we were to drive our vehicle, all of these gauges, what's the most important gauge of them all? Maybe it's the fuel. Can't go far if you don't have gas, right? What do you guys think? Type it in the chat, unmute yourself. That's fine. I'm not picky. But if we were to look at all of the different features and pieces of information available to us, wouldn't you think the most important piece of information would be our windshield, right? Looking out that window is the best way to see where we are going. And that's what I try to equate blood glucose monitoring to. So it's tough to know where you are going if you can't really see what's going on around you. So all the different gauges in our car are helpful, but the most important piece is what's right in front of you. And that's how blood glucose monitoring can help you. It gives us some insight into how things are going with regards to our diabetes. We can use our blood sugar for reaching our target goals. We can detect changes based on medication adjustments. We can see how activity might affect our blood sugar. We can see how certain types of foods, maybe you had a celebratory event, you went out and had a large dinner, and by checking your blood sugar, you can see how that particular food may have affected your blood sugar. But what you do notice here with the terminology that I have on the screen there is I don't have the word test. So that's just one of my particulars. And again, it's something that more and more practitioners are starting to embrace, because if I were to say test, usually that carries with it some negative connotation. That indicates a pass fail outcome. Raise your hand if you've ever described your blood sugar as being bad or good. It happens. It's human nature to describe it in those terms. We've been brought up to use a lot of these words, but research shows that this has somewhat of a negative connotation and really, makes the struggle for managing diabetes a little bit greater. So what I want you to do is think of blood sugar not so much as being good or bad, but rather it's in range or outside of range. And checking your blood sugar just enables you to see out your windshield to see how you are doing. Everyone will have different guidelines. Depending on the type of medications you might be on. You might be checking it 4 times a day, or you might only check it once a day or once a week. Your doctor and your healthcare team will reveal with you what might be the best step for you in terms of managing your diabetes. But I try to get away from using the word test and really try to discourage people from saying their blood sugar was good or bad, because there's so many factors that you're going to learn about that affect that number. And I don't want to, levy blame on there unnecessarily. So why is it a big deal? Anyone's ever had an elevated blood glucose reading that's been 200 or 300? Probably didn't even notice it, right? Probably didn't feel any different, didn't really hurt. But what we know about elevated blood sugar is that it's a pretty common denominator for complications. So the more consistently our blood sugars remain elevated, the more damage it can do to the small blood vessels of our body. And because of that damage, that's why high blood sugar can be such an important predictor of long-term complications. So everything that we're trying to do is to try to keep that blood sugar level within range, because if we are, we can help keep those blood vessels healthy. All of the damages that we know about diabetes with regards to stroke, blindness, heart disease, kidney damage, foot infections are all because of deteriorations in circulation. So this is why it's very important to try to monitor your blood sugar as directed by your physician, because we want to try to minimize those risks for complications. So again, yes, maybe an elevated blood glucose may not hurt, it's not like when you stub your toe and that really hurts and that reminds you to watch where you're walking. But over time, even though it may not hurt, those small blood vessels are really starting to break down, and in light of elevated blood sugar readings. So we want to try to do our best to try to keep it within range. Now, how often, as I said, you might check blood sugar will really depend on your type of diabetes care. Typically, if you are taking insulin, you're probably going to want to check your blood sugar level in conjunction with those injections, maybe anywhere from 2 to 4 times per day. If you're on just one single oral agent, say you're just taking metformin, the doctor might say, you know what, I don't really know if we really need to check your blood sugar all that much. We will just monitor it during your physician visit. So again, it's really up to you and your physician to discuss what type of frequency you need for blood sugar monitoring. But as I said before, if you are taking insulin, it really is strongly encouraged that you check your blood sugar in conjunction with those injections, because of the risk for getting hypoglycemia. So that range, as I said before, we don't want to talk about blood sugar as being good or bad, but most of the research shows that if we can keep blood glucose in that range of 80 to 130, we're going to see better long-term outcomes. If you just had something to eat and you're checking your blood sugar, let's say about 2 hours afterwards, we're looking for that number to be 180 or below. Now, again, if it's 240, is that bad? Are we going to describe it as awful or terrible? No, we just need to look at that number and say, okay, what may have caused this number to be high? Is it something that I ate? Is it some other type of infection? Again, it's all about trying to apply problem solving when we're looking at blood sugar and not try to defeat ourselves unnecessarily, because as I said before, there's a lot of work in managing diabetes, so we don't want to pile it on ourselves unnecessarily. So looking at blood sugar readings, again, you and your healthcare team will come up with some more specific goals to you, depending on where you are in your diabetes treatment plan, but usually trying to keep it within that 80 to 130 range before meals is going to be what's considered optimal. Now, if we were to look at that number, sometimes we're like, what does that even mean? 80 to 130 milligrams per deciliter. Well, that really equates to about 5 teaspoons of sugar. If you, or excuse me, 1 teaspoon of sugar in your blood. So if we say on average, you got 5 liters of blood in your body, 100 milligrams per deciliter, that's about 1 teaspoon of sugar. So very, very, very small amount when you consider all the blood that we have. But again, the higher that is on a more consistent basis, the more damage it can do to our blood vessels, which is why we want to pay very close attention to it, and why there are also other tests that can be done to look at long-term blood sugar, which we'll talk about later on in our session. So again, looking at some of the charts, we've got different guidelines by different credentialing agencies. Those numbers that I shared before were from the American Diabetes Association. The American Association of Clinical Endocrinology has a slightly different number. Again, all trying to keep us at or below 180 as often as possible. Once we start to get above 150, that really starts to cross the renal threshold. So that's where sugar can begin to spill into the urine. And again, that's usually consistent with, some diabetes issues that probably need some quick attention. So the more often we can keep it outside of that higher level, the better long-term outlook that we have. Now, if we look at some of the other goals for diabetes care, you might notice that these numbers on your screen might be a little bit different than what your doctor or healthcare provider has told you. We do know that if you have a risk of running a very low blood sugar without any symptoms, something called hypoglycemia unawareness, your doctor say, hey, you know what? I want you to have yours at 130 or above. Or if you're older, maybe it needs to be a little bit higher to reduce the risk of insulin shock or hypoglycemia. Any underlying condition is going to impact how tightly your blood sugar level needs to be monitored. Individuals who are pregnant or wanting to become pregnant likely will have tighter glycemic goals than individuals who are not, because of some of the risks that can become with elevated blood glucose during pregnancy. So again, varies depending on age and health status. What I'm sharing here are just some general guidelines, and definitely not meant to replace anything your healthcare team has already told you. So again, as we move forward here, always feel free to drop in comments and ideas in the chat, just to let me know you're here. Let me know you're getting this information, and really let me know if there's anything else I can do for you. But when we do something like this via Zoom and trying to educate on how to check blood sugar, it can be a challenge, but there are some common denominators across all types of different meters that work no matter what kind of brand meter that you are using. And that's what you see up on your screen right now. First and foremost, those test strips, they're very expensive and they're very sensitive to moisture. So when we talk about making sure we're having clean hands, we also want to have dry hands too, because as we reach in that test strip bottle and pull out a strip, if our hands are damp or dripping with water, that could damage the rest of the test strips in that bottle. So we want to try to make sure that in addition to being washed, our hands are dry too. You don't have to use alcohol swabs. In fact, alcohol is typically not recommended because it tends to dry our hands. Of course, 2+ years in the pandemic, we've probably bombarded our hands with enough hand sanitizer that moisture in our hands is probably long since taken off. But again, just soap and water is perfectly fine when we look at how to check blood sugar with clean hands. As you see, you're going to insert a test strip in your meter. You're going to prick the side of your fingertip and hold the edge of that test strip to that drop of blood. Some hacks that can help stimulate that process is washing your hands with warm water. That can help get a more an easier time getting blood from your fingertips if you're somebody who struggles with that. Another thing that you can do is basically grab your bicep and gently massage your arm all the way down to the hands. That'll help improve some of the circulation in the hands if you're somebody that has a tough time getting a decent sample from those fingertips. And most meters will give you your result after a few seconds. So we've come a long way in the technology that's used with blood sugar meters. I know when I was first diagnosed, without giving too much away about my age, when 1988, we had a Lancet device that looked like a mini guillotine. And every time I pressed it, it would almost came through my finger and made me wonder if it was coming out the other side. So it's a lot more gentle to prick our finger these days, and the sample of blood size is a lot smaller than what was needed. So again, every meter generally operates the same way in terms of applying blood to a test strip to see how it reacts, and then the meter checks that reaction and comes up with an answer. So just follow the instructions that came with your meter. But my little trivia question here for you: why should you only use the sides of your finger? So type your answer into the chat and I'll let you know if you win a magical prize. Why should you only use the sides of your finger when checking blood sugar levels? You might find that getting blood's a lot easier if you use the fingertip, but the sides of the finger, what do we think? The sides of the finger. All right, very good. We got one good guess here, less painful. And that's actually the correct answer. But if we look at the rationale behind that answer, it's less painful because you have less nerve endings on the tips, on the sides of your finger. You have more nerve endings on those tips. So the other thing, besides being less painful, if you stick to the size of your finger, you're also protecting those nerve endings, because we want to have pain receptors in our fingertips because that alerts us when we touch something hot or something happens. So we don't want to damage those pain receptors either. So it is less painful and it helps protect those nerve endings on our fingertips. So always try to use the sides of your finger. And if you're somebody who's checking your blood sugar on a more frequent basis, it's good to rotate, rotate through each of those fingers, each sides of those fingers. So that way you're not continuously going to the same finger time and time again. So very good. Thank you for those that contributed there. I appreciate that. How accurate are these meters? So we always think that, well, gosh, whatever meter I get at the store, I just assume it's accurate, and it is. And to some extent, there are some exceptions. So the FDA, the Food and Drug Administration, they're the ones that credential these meters. So they look at a meter based on data that's reported by the company. So in many cases, the FDA isn't going out to these different factories and testing meters on the spot, but they will clear a meter based on some of the company reported data for accuracy. And that data has to be within certain parameters when we look at accuracy. And what those parameters state is that whatever is measured in that blood glucose meter has to be within 15% of a lab measurement. So when you go to the lab and get your blood taken for a variety of tests, it has to be within 15% of that reading 95% of the time. And 99% of the time, it must be within 20% of that true value. So that's the guidelines that the FDA is looking at before they will clear a meter to be sold. So it's very important to understand that. But the other thing, as I said before, it is company reported data, and it's not always the best data. So there has been some independent studies done. The most recent in 2018, where the Diabetes Technology Society looked at several meters and determined how often they came within 15% of that lab value. So you see the devices that pass were the Contour, the Accu-Check, the Walmart Relion, the micro version, the Freestyle, the CVS meter, the Accu-Check SmartView. But we also have some other meters that didn't pass: the One Touch Vario, the One Touch Ultra, the True Result, the True Track. So again, you'll see the differences there in terms of accuracy. Some were just outside of that 95%. Some were, darn near just 70% accurate. So some things to consider when evaluating those meters that are out there. And as before, we will send out these slides to everyone that's registered in this program. So if you want to kind of go back and cross-check what you might be using at home and pull up the link to this study, you are free to do that. I did want to tell you something though. As a GatorCare member, you are eligible for no cost test strips and a no cost meter. There are certain parameters that have to be met. It is for all GatorCare members and their dependents diagnosed with diabetes. There's a short learning module that you watch that talks a little bit more about monitoring. It's like 15 minutes long. But when you complete this program or when you complete this training, you can get your test strips filled at no out-of-pocket cost to you. Again, these meter strips can be very costly. If you're paying for them out of pocket, it could be anywhere from, $30 to $60 per bottle. And if you're using 1 to 2 bottles a month, that can really add up. So it's a program that I wanted to make sure that you were aware of because, not everyone is able to pay attention to all the information that comes across their screen on a daily basis. But this is a very important benefit, I think, especially for those of you that are checking your blood sugar on a regular basis for your diabetes care. And you'll be happy to know that that Contour meter was one of those ones that was deemed to be the more accurate out there. Again, actually, in this particular study, it passed 100% of the time. So that would have been really awkward if we had one of the meters that didn't pass. But again, this is a program that I would encourage you to take advantage of if you're not already, to help get you connected to some lower cost diabetes supplies. When we look at other technologies out there, there's also something called continuous glucose monitoring. So you may have seen commercials for this. I know the Jonas Brothers were part of one, or Nick Jonas was part of one for the Super Bowl for Dexcom. That was the first time I'd seen anything like that hit mainstream. But what continuous glucose monitoring does is actually measuring glucose, not in the blood, but in our interstitial fluid. So you can see the difference on your screen where that sensor is relative to our blood vessel. Basically, blood sugar levels fluctuate in our interstitial fluid just like they do in our blood. So we can detect those changes on a continuous basis by wearing a sensor under our skin, or the sensor itself right at the skin, and then the sensor right on top of the skin can measure those fluctuations in blood sugar and basically give us a reading every 5 minutes. This sensor is placed by you. It's nothing that has to be surgically done. It's, depending on the type of CGM device that's being used, it can be replaced anywhere from 7 to 10 days. There is another sensor on the market called Eversense that is a 3-month placement. That one does have to be placed at a physician's office, but all the others are essentially do it yourself. What happens is the sensor is connected to a transmitter that sends the data to a monitoring device or a smartphone. It's done typically through Bluetooth, and the user will get their results that way. This replaces finger sticks. So it used to be when CGMs first came out, you would still have a finger stick to calibrate it. But now, since they've been able to advance so well, they're able to provide treatment recommendations without the need for finger sticks. So this is a device that will always give you insight into how your blood sugar is doing, how it adjusts from meals to physical activity, and so forth. One good question that just came in there: are CGMs typically recommended for those individuals on insulin? Is it the only are the only people that could benefit? That's a great question. Typically, it's best served for those people who are on insulin because there tend to be some more variations in blood sugar. But if you're somebody who's had, to use several different diabetes medications outside of insulin, and your doctor is trying to maybe get some temporary insight into where your blood sugar levels are trending morning, noon, and night, there might be a need to do it for non-insulin users. But yes, typically those individuals on insulin are the ones that are best suited for CGM use. So as I said before, it'll minimize the need for finger sticks. It looks at the trends. So you could be checking your blood sugar every morning and it's 108, but you might know that, oh, well, in the evening it's 208. So it helps nail down some of those variations in blood sugar. I will tell you this, that under GatorCare, Dexcom is the preferred brand, but you will also note that Freestyle Libre and Medtronic Guardian Connect, which is connected to their insulin pump, are some other CGM options too. And there are some exceptions that can be made outside the formulary, but Dexcom is pretty much the standard CGM device that's used for those patients under GatorCare. The other very important measurement that's done, and it's typically done in conjunction with our blood sugar measurements, that's the A1C. So we've probably all heard this term before, and the full name for it is hemoglobin A1C. This is typically used to diagnose individuals with diabetes, but it also reflects average blood sugar over a 2 to 3 month period. And what it's actually measuring, when you look at it as far as the percent, people had an A1C of 7% or 8.5% or 11.1%. It's measuring what percent of those hemoglobin proteins on our red blood cells get coated with sugar. So the higher that percentage means that the higher the blood sugar level has been running over the past 2 to 3 months. So again, it's an average. So there still can be some great variation in day-to-day readings, which is why checking your blood sugar and checking your A1C helps kind of give more insight. So again, things to look at when we look at some of the monitoring options that are out there. I will tell you this, that it's measured anywhere between 2 to 4 times per year. If the A1C level is at target, your healthcare team might decide that, we just want to check it every 6 months. If there have been some medication changes, or you're trying to really take a closer look at the blood sugar levels over a shorter period of time, they might recommend it 4 times a year, but that would be the most, because when we look at it, it's only measuring blood sugar level for the past 3 months. And your next trivia challenge here, why is it only able to go back 3 months? Why is it only able to go back 3 months? Can't go back 4 months, can't go back 5 months. 3 months is as far back as a single A1C measurement goes. So if you were to check your blood sugar, your A1C right now, it would tell you all you need to know about your blood sugar for the past 3 months, but it can't go beyond that. Anyone want to try to take a guess as to what that might be, what the reason is behind that? This might go back to some of your biology days, learning more about how red blood cells, their lifespan. Very good. The life of the red blood cell is about 3 months long. So again, that's why that A1C measurement can't go beyond that. And it's also why you wouldn't really want to check it any more than 4 times a year anyway, because it's not going to give you much additional insight. So very good. Thank you. So as we look at wrapping up and looking at problem solving with blood sugar, so we're all aware that everyone's need to check blood sugar is going to depend on what their treatment plan consists of. There are some high-tech options out there if you're on insulin that can be very helpful, such as a CGM. But remember that there are several factors that impact a person's blood sugar. And again, this isn't a test. This is just a matter of assessing where you are. So when we look at a blood sugar level reading, it could be impacted by the food you ate, the type of exercise that you just did, or the type of medication that you're on. Those are essentially the key factors. But believe it or not, there's about 35 other factors that go into impacting a person's blood sugar. You could be impacted your blood sugar through stress, through the time of day. Typically in most cases, as we get up in the morning, our liver starts to kick out a little bit more sugar. So blood sugar levels typically run a little bit higher in the morning for some people. Illness. So if you have come down with an infection, that could also raise your blood sugar levels. There could be medications that could impact your blood sugar. I think many of us are well aware that steroid therapy can really have an impact on our blood sugar levels, your hydration status, menstruation, sleep. all of these can go into impacting a person's overall blood sugar, which is why we want to try to stay away from that good or bad descriptors. Oh, my blood sugar was bad. It was 200 or something like that, because there are so many factors that are outside of our control when we look at blood sugar. So what we really try to task people to do, at least through our operation here, is to problem solve. Okay, well, your sugar is running high, or it's running low, or it's running outside of the suggested range. Why might that be? Is it because of higher amounts of food than usual? Is it less activity? Was a medication change made? Are you just getting over a cold? Again, that's what we want to look at, because again, it's not about trying to grade yourself and beat yourself up over some of these numbers. It's all about trying to take action. Remember, we said in the very first class, diabetes is the one condition where you're in charge all the time. We look at other conditions that really need steady guidance from our healthcare team, but with diabetes, you're there every day. And what we want to try to do is apply some problem solving to that. And that's going to be a big part of the end of this program, is looking at some of the ways to problem solve beyond just monitoring. But when we look at, monitoring some real life scenarios, some struggles that invariably pop up, I'm going to throw quite a few on the screen here. Maybe this is you, maybe this is someone you know. See what we would do to get through these real life scenarios. So let's say, plan to check your blood sugar after meals, you keep forgetting. What can you do? Maybe your pre-dinner blood sugar readings are above the target range. Maybe you're really worried about what people are saying or thinking when you're checking your blood sugar in public, or you don't check your blood sugar as much because you really don't want to do it in public, which is understandable. Checking your blood sugar hurts, okay? Or your spouse always wants to know your results. So these are some real life scenarios that can really pose a problem with maintaining consistency with blood sugar monitoring. But for every problem, there is a solution. So some ideas to consider for these real life scenarios. Can't remember to check your blood sugar? Set a reminder on your phone. Pre-dinner blood sugar readings above the target range. Take a look at any of the evening meals you had the night before, or maybe had an evening snack where if your carb intake was above average. Don't like to people looking at you when you check your sugar? Well, go to the restroom or find a private location. Avert some of the pain by remembering to just use the size of your finger, as we said, less painful, but you can also adjust the depth control of your lancet. Remember, I said before early on, those lancet devices only had one depth, and that was ouch. But now it can go just below the skin to get a small amount of blood, which is all that's typically needed for most of our test strips. And let's say we have a spouse that is really kind of on us about those results, and sometimes is a little bit overbearing if it's outside of the range. So just acknowledge their interest, and hey, maybe ask for their support in developing a plan for above or below target results. So some ideas to navigate through some of these real life scenarios that can occur and can be a problem, can really be an obstacle to care. But through this program, we're trying to give you the tools you need to navigate through some of these challenges. So one homework assignment, just like any other good homework assignment, we want to make sure that it's done. And I'm not going to collect this particular one because of confidentiality reasons, but I would really encourage you, if you are checking your blood sugar. So again, I'm not telling you to invest in a meter if your doctor said you don't really need to check your blood sugar that often. But if you are, consider contacting GatorCare to join their test strip program, and maintain a 7-day blood sugar log to note how certain foods and activities are affecting your blood sugar level. So I'm not going to collect this via email, but this is something that we're going to look at together. Remember, through this program, we're inviting each of you to take part in an individualized diabetes education session where we talk one-on-one about how you are doing with your diabetes. And through this meeting, we'll talk a little bit more about this blood sugar log, as well as anything else that might be going on in your diabetes lives to see what type of help we can further offer. So I will hang out here in the chat to answer any questions. I want to remind you that, we still have a couple of more sessions left. Next week, I'm going to be talking about some of the more prevalent risk factors for not just the diabetes complications, but also what are some of the other things to be aware of when we look at monitoring in diabetes. So it's not just about blood sugar, but also blood pressure, and what are some guidelines for preventative care with regards to taking care of our feet, taking care of our eyes, and making sure our nerves are doing the things that they're supposed to do. So all about reducing those risks of long-term complications. So thanks everybody for tuning in. As I said, I will hang out here, but I'm going to stop the recording and look forward to chatting with you again next week.